Hello everybody and welcome to the Thursday edition of Video Clips. I want to talk about whooping cough today, and I want to talk about it from a couple of different perspectives. One is the efficacy of vaccination for whooping cough, and then some interesting information that I've been able to dig up about how to treat whooping cough, because at one point in time we didn't have a vaccine for it. All right, so let's just start with what is whooping cough. It's a highly contagious upper respiratory infection caused by a bacterium called the Bordetella pertussis. Inflammation and swelling in the airways results first in symptoms similar to the common cold, things like runny nose, sneezing, and a low-grade fever with a mild cough. In fact, most people, when they first contract it, think they just have a cold. In the second stage of the disease, the cough becomes much more aggressive. Bursts of coughing become more severe, followed by a labored inspiratory effort that sounds a lot like a high-pitched whoop, which is where the name of the disease comes from. During an attack of coughing, the person can suffer from a lack of oxygen and turn blue. It can be quite frightening. The whooping cough vaccine has been determined to be as much promise as it had when it was introduced, largely ineffective, with outbreaks reported now in 49 states. An article in Pediatrics concluded, quote, "Lack of long-term protection after vaccination is likely contributing to increases in pertussis among adolescents." So hence we've seen more boosters, we have to get inoculated more often for it, but even that doesn't seem to be making much of a difference. Another outbreak in fully vaccinated preschoolers, which was reported on Medscape, concluded that the situation, quote, "raises concerns about inadequate protection against pertussis in an age group believed to be well protected by acellular pertussis vaccination," end of quote. They added that this episode calls into question the effectiveness of vaccines for preschoolers, and that, quote, "recent pertussis vaccination should not dissuade physicians from diagnosing, testing, or treating persons with compatible illness for pertussis." In other words, the vaccine may not even work in the short term, and doctors who see patients who have symptoms that could look like pertussis should assume that it might be that and treat patients accordingly. The authors also noted that the number of whooping cough cases jumped sixfold between 2000 and 2012, stating that the cause may be that the virus has mutated, which has lowered the rate of vaccine-induced immunity. A Cochrane review concluded that, quote, whooping cough epidemics in the pre-vaccine era, that is before the mid-1940s, occurred at 2 to 5 year intervals, and these cycles have continued in the vaccine era. The reviewers also noted that the incidence of whooping cough has actually increased during the last 20 years in spite of widespread vaccination. Well, actually, the whooping cough vaccine may not have been needed at all. Public health data show that at the beginning of the 20th century, it was true that the leading cause of childhood mortality was infectious diseases like diphtheria, measles, scarlet fever, typhoid, and whooping cough. But by 1998, the death rate from major infectious diseases for U.S. children had declined 99.7%, and 90% of this decline took place between 1900 and 1940, before most vaccines and few antibiotics were available. So whooping cough death had been virtually eradicated before there ever was a vaccine. So the vaccine was a solution looking for a problem. Since vaccination doesn't prevent whooping cough, treatment is needed in some cases, and probably more cases than people realize. Antibiotics are often recommended, but according to another Cochrane review that involved 13 trials, there's no evidence that antibiotic treatment is effective or that it improves the clinical course of the illness. What does seem to help, believe it or not, is high-dose vitamin C. I started looking for articles in medical journals before the onset of vaccines and antibiotics and that sort of thing, and I managed to find something in 1937. It was an article in the Journal of the Canadian Medical Association. It references several articles reporting case series in which whooping cough patients were treated with vitamin C, and all of the cases resolved. One article included 81 cases. Well, the authors of the article that I'm referencing here reported 17 cases of their own in which oral ascorbic acid was successfully used. Now, the objective of treatment was twofold. This group wanted to show that the vitamin C could be administered orally instead of intravenously. They also wanted to try to quantify what is the exact dosage that was needed, because there were some questions about this in the previous research articles. So what they did was they gradually increased the dosage, stopping when the patients achieved remission from all symptoms for 2 consecutive days. The average total dose of vitamin C was 2,700 milligrams, regardless of the age and weight of the patient. The researchers reported that in 17 of the patients included in the case, that for 17 of the cases included in the series, the average duration of whooping cough for children was about 13 days, and the 2 adults who were part of the study were cured in 4 and 6 days. 2 of the patients were a 7-month-old baby with whooping cough and who was still breastfeeding, and the mother who was breastfeeding. Improvement was noted first in reduction or complete cessation of vomiting, followed by reduction or cessation of night cough, and then eventually a reduction and the severity of day coughs too. The researchers commented on dietary sources of vitamin C, not necessarily saying that you could get enough vitamin C from diet to address whooping cough, but they wanted to point out that cow's milk didn't have any, and even unpasteurized cow's milk didn't have any. You find vitamin C in plant foods like oranges and orange juice. I thought it was interesting that they included that. Now, the limitations of the study and several of the articles cited include that these are case series. These are not randomized controlled trials, but nonetheless, they report a consistent story, which is that whooping cough patients improve when they're given supplemental vitamin C. Also, remember the case series included a 7-month-old and his breastfeeding mother. Well, this is important because according to the Centers for Disease Control, unvaccinated infants younger than 12 months are at very high risk of severe and life-threatening complications from whooping cough. So the idea that the most at-risk population responds to something that's pretty harmless like vitamin C is very, very important. The CDC also, I went to the CDC's page on this, and they also report that symptoms can last for as long as 12 weeks. And remember, the average time for resolution in this study was 13 days for children and between 4 and 6 for adults. It's almost certain that we'll never see a randomized trial comparing, for example, vitamin C against antibiotics or supplemental vitamin C versus food, but there's little risk associated with taking vitamin C supplements for a short period of time. The only usual solution offered is antibiotics, and according to Cochrane, which is the most independent medical research organization on the planet, they don't work. So I think that clinicians can safely prescribe vitamin C along with rest, fluids, and optimal diet with little downside and considerable upside potential. All right, that's all for today. As usual, pass this on to anybody who you think would enjoy watching it. This article with references will be posted in the library by the time you see this video.